Let's get going. I haven't had a chance to say hi to Heather. And so hi, Heather. I'm happy
Hi.
that you're here. We're thrilled to have Dr. Heather Finley with us today. She's a gut specialist. She has a doctorate in clinical nutrition and a gut health specialist, and also my dear friend. So it's really a joy when I enjoy doing these webinars anyway, but when I get to do it with my friends, all the better. So Heather will tell you more about herself, and she'll dive right in. I'm gonna turn the time over to you, Heather. I'm gonna turn off my mic and my video, but as you know, I'm here. So if you need
Okay.
me, holler, I'll pop back on. Otherwise, I'll just see you at the end of the presentation, and we'll do some questions at that point.
Okay. Awesome. Well, I am so happy to be here. I'm going to go ahead and share my screen. I hope you all are having a less tech issues of a day than I am, but like Tamara said, so glad to be here and to share this hour with you. I know many of you are coming like in between sessions and lots of other obligations. So it truly means a lot that you would spend the next hour with me, wherever you are joining from. So I would love to hear from you. If you want to reach out to me and let me know what stuck out from this webinar, or if you have any questions, I am an open book after, and I have my contact information on the last slide. So I would love to hear from you, but let's just jump right in. We are going to chat today about some root causes with GI issues in clients with eating disorders. Now, I am assuming that if you are here, you have either seen a client with an eating disorder, you are currently seeing clients with eating disorders, or you want to. And so, whichever bucket you fit in, maybe all of them, I'm so glad you're here, and I hope that you will learn something that you can take away and apply with your clients even today in your next session. So, I always like to start off by sharing a story. I had a brick and mortar private practice for many years, over a decade. Now, my practice is primarily online, and we see clients all over. But I still see tons of clients with disordered eating and eating disorders and GI issues. And I remember when I was first starting my practice, I started getting all these clients that were coming to me with GI issues and a co occurring eating disorder, and they just felt stuck. They're sitting there, they're trying to do all the right things, and yet they're so held back by their GI issues. And I saw that there was a huge gap in the care for these clients. They had their GI treatment team, they had their eating disorder treatment team, but nobody was communicating. And it led to this really vicious cycle of not only clinician frustration, because I'm sure you've been there and I've been there too, but also client frustration of, what is actually going on? Why am I so bloated? Why am I so constipated? Why am I so miserable? And why can nobody figure this out? And so I had my own struggles with GI issues, which is a story for another day. But in those moments, I decided I have to figure this out because I am so sick of having clients coming to me with these co occurring issues and feeling really helpless. They're so bloated that they're uncomfortable and they don't want to eat, and that's impacting their treatment progress. Or they haven't had a bowel movement in 7 days and they're so miserable. And so it made it my mission to figure out what was going on. And that's what we're going to chat about today. So, some of the common symptoms that you might see in your clients would be constipation, diarrhea, acid reflux, regurgitation, bloating, stomach cramping or pain, and nausea. There are many more GI symptoms that can happen, but these are probably the most common ones that you see. And you probably see clients that have more than one of these symptoms. It's very unusual that you would have a client that's just constipated and not also bloated, or that just has acid reflux and isn't also dealing with stomach pain or something else. And so this can be just this kind of conundrum that you run into is like, how are all of these symptoms actually connected? And how do we, instead of creating just more diagnoses and more confusion and more overwhelm for the client, how do we figure out what these symptoms are actually rooted in so that we can actually help our clients get better? Because more than likely, there are a couple root causes that are all under the surface. So, just some stats to share with you. Up to 69.2% of individuals with eating disorders report GI complaints. I've seen some studies that say 80. I've seen lower. So, who knows? But it's a lot. That's what we know. A very large percentage of individuals report GI complaints of various kinds. And symptoms can affect overall nutritional status. And I'm going to chat about that and why. And then their mental health as well. The Journal of Gastroenterology notes that patients with eating disorders often have various GI disturbances. They might have postprandial fullness, they might have abdominal distension, or what we call bloating, or even abdominal pain. But here's what could happen, and I hope you feel some hope about this after this presentation, is that we can improve GI symptoms and improve outcomes and recovery timelines. Who doesn't want that? We can also increase body confidence as symptoms decrease. If your client isn't feeling 6 months pregnant with bloating when they're not actually pregnant, they're going to be a lot more compliant with their meal plan, most likely. If they are able to have a bowel movement every day and they haven't dealt with chronic constipation, they're more than likely going to be a little bit more compliant. And obviously, there's layers to this. But if we can take away some of the GI complaints, we will see improvements in outcomes and then possibly prevention of further GI issues down the road. I could tell you many, many stories of clients who I've seen in the past that really didn't deal with their GI issues. And years later, even after being in recovery from their eating disorder, they're dealing with things like SIBO or gallbladder issues. And so we don't want to ignore the GI symptoms because we don't want them to get worse either. So, today, some of the things that we want to learn and some of the objectives that we have are identify some common GI symptoms. We already chatted about that. Describe how disordered eating behaviors contribute to root cause GI imbalances. And then I love giving practical takeaways. I never want to sit in a presentation and then wonder, okay, what do I do? So, we're going to do a lot of practical interventions on what you can actually apply with your clients. So, let's chat about some of the physiology and some of the mechanisms behind this. In case this is new information or something that you're just learning, the gut brain connection is a bidirectional connection. So the gut and the brain communicate via the vagus nerve. They also communicate via neurotransmitters and the microbiome. Your microbiome or your gut microbiota, which is the collection of bacteria in your gut, they have a huge say in mental health. And what I think we often forget is we are really good at remembering that anxious mind equals anxious gut. But what we forget is that anxious gut also equals anxious mind, and that pathway is bidirectional. So when we fix the gut, we also can improve outcomes in the brain. So, chronic GI stress, bloating, constipation, reflux, you name it, will increase anxiety around eating. It can reinforce food avoidance behaviors, and GI relief will reduce somatic distress and make food related experiences feel a little bit safer. So, let's talk about some of the physiological impacts. And if this is all new information to you, no worries. You have the slides. You can go back and save some of these charts, screenshot them, whatever you want to do. Low enzyme production and low stomach acid are some of the things that we see most commonly with disordered eating, which physiologically can lead to poor nutrient absorption and psychologically can lead to more fatigue, increased stress response. But let's chat about this for a second because I think oftentimes when I mention this, people get really confused. Oh, my client has acid reflux. Do they have, there's no way that they could have low stomach acid. But I'll tell you that, of course, every client is individual. But one of the things that we do often see, even with acid reflux, is that somebody might actually have low stomach acid. Your stomach acid is really the first step of digestion after you salivate and swallow, of course. But your stomach should be as acidic as battery acid, and it should be able to not only break down your food, but also help you extract nutrients from your food. And if it's not acidic enough, we see things like poor nutrient absorption. We also can see things like H. pylori infections, and we will see that then affect everything downstream. And I have a couple visuals later on that might help bring this home for you. The next thing is dysbiosis and inflammation. If dysbiosis is a new word for you, essentially what that means is an imbalance of bacteria in the gut. Now, I mentioned the gut microbiota, or the collection of bacteria in the gut. You have trillions of bacteria in your gut, and they do lots of different things for you and your clients. And when we see an imbalance of bacteria, we will start to see GI symptoms. Sometimes we will see anxiety. Sometimes we will see skin related issues. It doesn't just affect the gut. And so, dysbiosis doesn't always mean too many quote unquote bad bacteria. It can also mean too few good bacteria. And we see that a lot with disordered eating from really restrictive dieting, not eating enough, a lack of variety, etc. So, we will see altered neurotransmitter production when there's dysbiosis and inflammation in the gut. And then this can impact anxiety and depression as well. Delayed gastric emptying is something that you likely see with your clients. These are the clients that will go days without a bowel movement. They're super constipated, they're super bloated, they might be experiencing acid reflux. This is going to increase fullness because they have a bunch of food sitting there. Sometimes this can be due to low stomach acid or poor enzyme production. This causes higher distress around meals and can lead to slower weight restoration. And then lastly, constipation and bloating. Probably a really common experience for many of your clients. This can heighten body image concerns, and it can create resistance to refeeding or a fear of weight gain. So let's chat about these even further, but also why GI relief is really critical for sustainable recovery. When we have normalized digestion, so when I say normalized digestion, what I mean is that someone can eat food, their body can digest it appropriately. It can extract nutrients from it appropriately. It can then process the food appropriately and then have a bowel movement and excrete it appropriately. That's really the whole process that we're looking at here. This is going to help with mood, with energy, and just overall physiological function. We will see reduction in bloating, in reflux, constipation, body image distress. And then when the discomfort subsides, clients are more likely to stay engaged in treatment without feeling the need to restrict or purge or engage in behaviors because they're so uncomfortable. And I'm saying this all while knowing that obviously there are other triggers for these things. What I'm talking about really is in the context of GI symptoms that might make somebody pretty uncomfortable. So here's just some more research that I wanted to cover. There's many studies. We could probably do a whole presentation on studies, and I think that there's more and more studies coming out all the time. But gut microbiome imbalances in eating disorder clients are correlated with increased anxiety and food avoidance, which prolongs recovery. We also see persistent GI symptoms having a higher rate of treatment dropout and relapse. And then treating functional GI symptoms, so constipation, bloating, etc., in eating disorder clients led to improved refeeding success and fewer relapses. Sounds great, right? So, how do we actually do this? So, I want to talk today about some of the root causes that we see that need to be addressed with GI and eating disorder clients. Low stomach acid, I mentioned that. We need our stomach acid to help us break down food, and there's lots of things that we can do to improve stomach acid, which I'll talk about later. Poor digestion. So we rely heavily on our pancreas as well as our liver and gallbladder to help us break down food via various enzymes and bile. The interesting piece here is that when somebody has inadequate stomach acid for whatever reason, This will also have an impact, most likely, on pancreatic output and the liver and gallbladder because nothing in the GI system works in isolation. When the whole system kicks off, think about a time where we just had Easter, or think about a holiday. Maybe you walked into somebody's house and you smelled food and you started salivating and you thought, I wasn't really that hungry until I smelled that food, right? That is the first step of kicking off digestion. That salivation actually will then signal your stomach acid and say, hey, food is coming. Let's get the process moving. That then signals the pancreas and the liver and the gallbladder to start kicking it into high gear. And this also applies to clients that maybe don't have a gallbladder, because although they might not have a gallbladder, we still have bile flow that helps us with fat digestion. Gut motility disturbances is really referring to the contraction of your gut muscles. It's very easy to forget that just like any other muscle in the body, the gut can get out of shape. When the gut isn't used because of restriction or chronic laxative use and not actually having to contract, the gut gets out of shape. And so we have to get it back in shape where it's actually contracting and able to move food along so that somebody can go to the bathroom and excrete their food appropriately. We also will see gut brain disturbances. So when somebody is in a fight or flight state, the body does not know the difference between being chased by a tiger and sitting down to eat a meal. And although you've probably heard that analogy before, it's very true. And I'll show you a picture later that I think is pretty powerful. Mineral and nutrient depletion, this can happen from poor digestion and low stomach acid. It can also happen from just restriction, overexercise. Stress will dump minerals really fast. And so there's a lot of stressors on the body that require a lot of these minerals that your client needs to get all the processes in the body working. Dysbiosis, I mentioned that previously. Poor meal hygiene. This is a really low lift one, although easier said than done. How and when somebody eats. So, are they chewing their food? Are they taking their time to eat their meals? Are they watching TV while they're eating, or are they sitting at a table? Again, I say low lift, also knowing that the execution of this is much more challenging than it actually is, than it sounds. And then lack of rest. When you're constantly on the go and there's no rest and digest, maybe somebody's not sleeping enough, or maybe they just kind of have that go, go, go personality. The body digests when it's in rest and digest. So, here are some of the root causes and some of the potential symptoms, as well as maybe some relevant labs or assessments that you could consider. So, with low stomach acid, we may see reflux, we may see bloating, we may see undigested food in the stool. You can test stomach acid with the Heidelberg pH test. This is a very rare test that someone might do. You can also indirectly measure this on a stool test. So, if somebody has H. pylori, we know that H. pylori is going to lower stomach acid in a lot of cases. When we see low pancreatic elastase, we can also maybe assume there might be a stomach acid issue, not necessarily diagnostic, but those things do go together. With gut brain axis dysfunction, we may see high stress, we may see anxiety, we may see just kind of that digestive sensitivity, like they eat something and they immediately react because of that fight or flight response. You can look at heart rate variability, probably not something that you normally do. You can look at salivary cortisol, or you can just talk to the client and say, what are you doing to relax? And if they say, I can't relax, there you go. Gut motility issues, you may see constipation, you may see slow gastric emptying, you may see bloating. You can look at gut motility issues indirectly, looking at a SIBO breath test. If someone has high levels of methane in their breath test, likely that's going to slow their bowels down. You can do the smart pill motility test, not something that we typically do, but something that the GI doctor definitely can. With dysbiosis, you might see somebody have gas, bloating, diarrhea, and food intolerances. You can look at this on a comprehensive stool test. With mineral and nutrient depletion, you might see somebody have fatigue, poor digestion, anxiety, poor sleep. You can look at a comprehensive blood panel. You can do alternative testing like HTMA testing. There's lots of ways to look at this. Blood testing definitely is the best as far as like getting labs back quickly from, going to LabCorp, getting some of these run, which may be something that your client is already doing. And then you can always look deeper if you need to. And then poor meal hygiene. So they might have rapid eating, or you might actually see the opposite where they're taking too long to eat a meal. Bloating, difficulty digesting food. This you're mostly going to get from talking to a client and asking them questions about their meal hygiene. So, root cause approach takes time and proper assessment. And to be honest, this is where I see a lot of things go wrong when it comes to GI symptoms is we're so worried about getting rid of the symptoms so fast that we forget to ask some questions to figure out where is this actually coming from and how can I help my client. So, just a little digestion refresher. Digestion is a top to bottom process. When the top doesn't work, it impacts the bottom, and we need to assess these things in order. And really, what I mean by this is it's very easy, and I've done this before too, to say, oh, you're constipated. Let's try a probiotic. Let's see what happens. And really, that's like step 5 or 6. There are so many things that we have to get working before we would ever even consider maybe taking a probiotic or maybe trying some different supplement. And I want to show you how this all works. So, first phase is really this kind of gut brain axis cephalic phase of digestion. So, how is the client getting into a rest and digest state? You can see the picture here on the left-hand side. This is the rest and digest. And just to point a couple things out, there's a slower heartbeat, probably not the state I was in when I was having tech issues trying to log into this webinar. But Tamara was like, we're going to take a deep breath, and it worked. You'll see that it stimulates activity of the stomach. So it's going to secrete stomach acid. It's going to inhibit the release of glucose because we're not running from a tiger. We don't need glucose in our muscles. It's going to stimulate the gallbladder and then stimulate the activity of the intestines. This is an ideal scenario for digestion. Now, this is probably the state that many of your clients are in when they sit down for a meal and they think all the thoughts that they're having, right? So, this is not a perfect science, and this is always a work in progress that you are going to have to work on. Even if you're asking your client to just take a deep breath before they eat and slow down, trying to encourage that meal hygiene. One thing that we encourage our clients to do is to hum happy birthday twice before they eat to help to activate their vagus nerve and activate that rest and digest state. Whether you work in outpatient, whether you work in treatment, this can be a good, easy thing to try and perhaps maybe bring a little bit of light to the meal that maybe is already a little bit stressful. So we really have to work on this first because the gut brain kind of controls the show. Then you can see that there's a lot of steps here. I mentioned we all jump straight to which probiotic are we going to take, but look at all these steps of digestion. And I think that this is a great visual if you want to screenshot this and show it to your clients of all the different things that have to happen for somebody to be able to digest their food. Because we tend to focus here when in reality, there's a big tube that everything has to go through. So we have to chew our food. Then the esophagus has to push food down through peristalsis into your stomach. Then we need everything blended with hydrochloric acid to kill off bacteria or pathogens that we're exposed to and to help break down proteins and help us extract nutrients from our food. Then the liver secretes bile. The liver and the gallbladder work together with this to help our body digest fats. Then the pancreas is going to secrete enzymes to help us digest proteins, fats, and carbs. Then the food gets to the small intestines where it's mixed with other enzymes and bile to also continue processing food. Then it gets to the large intestine where the probiotic might take action. And indigestible food and waste are processed, stored, and dispersed. Then it leaves and the person is able to have a bowel movement. So, a very simple way of describing digestion, but hopefully you're getting the visual here that it is a connected pathway. It's a north to south process, and we can't fix what we kind of refer to as the gut without fixing the whole pathway. So, here is how stress or food restriction may impact or disrupt digestion. So, it's going to suppress the parasympathetic rest and digest function. It's going to activate the vagus nerve in a way that we don't want it activated. It will reduce digestive signaling. So, that is the stomach acid production and pancreatic production I was talking about. Stomach acid and enzymes are affected. This leads to poor protein and nutrient breakdown. This is going to impact our gut motility and bile flow, which causes sluggish digestion and food stagnation. This probably isn't like a great talk to do at 1 p.m. Central Time, wherever you are. It's probably around lunchtime. If you're eating, I'm very sorry. But we don't want food sitting in our gut going undigested. It gets stagnant. It can produce gases. That's where we will then experience things like gas and bloating. This can lead to dysbiosis or poor nutrient absorption. It will increase gut inflammation and imbalances in the gut bacteria. Then we see the symptoms. So, bloating, constipation, reflux, discomfort after eating. This can increase food avoidance and anxiety, and this kind of perpetuates the cycle. How many of your clients have said, I'm bloated when I eat XYZ food, so I'm not going to eat that anymore? And then they continue to be bloated even when they're not eating that food. It's so much more than just food. It is how our body is actually breaking down food versus the food itself. I always tell my clients this has a lot more to do with your gut environment than the food itself. Now, that being said, of course, there are clients that might be lactose intolerant or that might have a food allergy or that might have issues with food. I'm not discounting that at all. But in a lot of cases, you will have clients play this food blame game where they're saying, well, it's this food, so I'm just going to cut it out. Okay, actually, I'm still bloated. It's this food, I'm going to cut it out. And then they're down to 5 foods. They feel worse than they ever have. And they're wondering how they got here and how to get out of that cycle. So, a little bit more just about some of these root causes. And I'm going to go through these pretty quickly because you have these charts. And so that way we have time for questions at the end. But I wanted you to have all of this information. So, poor meal hygiene, you might see people eating fast in secret. You might have fear based rushing, avoidance at meals. This is going to impact minerals and nutrients. And you might see things like undigested food in the stool. You might see fermentation of undigested food in the small intestine, leading to that gas and bloating I was talking about, slower gut motility. We have to eat in a calm manner in order to kick off digestion. With low stomach acid, I've talked quite a bit about this, but some of the signs that you might see are undigested food in the stool, poor mineral absorption. Maybe this is a client that has chronically low iron. Maybe they have chronically low B12. Maybe they have just chronically low minerals in general. Burping, bloating, burning. The 3 Bs, burping, bloating, burning, they have all of those. It's a pretty good sign that they're not breaking down their food very well, and you want to look there. With poor pancreatic output, you might see carbohydrate intolerance. This can look a lot of different ways. You might see somebody getting really tired after meals. That can also be blood sugar related, but you also might see that they have tons of undigested food in their stool as well, or that carbs tend to really cause symptoms for them. Whether it's undigested food, whether it's fatigue, sometimes you might see vegetable fibers in the stool, etc. With poor liver function, you may see poor detoxification. You may see this kind of co occurring with poor gallbladder function where someone has chronically low vitamin D. We need to be able to digest fats and fat soluble vitamins, and without adequate bile flow, we can't do that. So, if you see chronically low vitamin D, that's kind of a sign that you might want to look into gallbladder function. Or another sign would be, let's say your client has really sticky stool or they're having to wipe a lot. You also want to look there. If they have co occurring SIBO, especially if they've had their gallbladder removed, those things often go together. And so it might be something that you want to check out. You may see poor brush border enzyme production. This is primarily in the small intestine. So this is the clients that are like, I can absolutely not tolerate fiber. Like the kind of the narrative of like fiber hates me, or I have tons of food intolerances. Typically has a lot more to do with the health of their small intestine than the food itself. And then dysbiosis, like I mentioned earlier, is mostly referring to the large intestine and imbalances of bacteria there, although there are some bacteria in the small intestine. So you may see bloating, you may see gas, constipation, and then poor fiber and food tolerance as well. Slow gut motility is one that is probably extremely common for your clients that are very constipated. Like I mentioned earlier, the gut is a muscle and it has to contract in order to move food and waste through the digestive tube. And if it can't contract because it's either out of shape, magnesium and potassium are really low, or they're dehydrated, you will see things moving very, very slow. And so this can lead to just this really chronic constipation, really chronic gas, really chronic bloating, especially the bloating that never goes away. If they're waking up bloated, likely there's a motility issue at play. We even see motility issues on our clients that are like, I've tried Linzess, I've tried pharmaceutical medications, and yet I still can barely go to the bathroom, or it causes kind of the opposite problem. And then mineral depletion. I think a lot of times with especially just chronic restriction, you're going to see minerals be pretty low. And what I always like to remind people is that minerals are kind of like the spark plugs of your body. So if someone is very mineral depleted, then the body doesn't have the tools that it needs to make enzymes like pancreatic enzymes to make stomach acid. Hydrochloric acid needs potassium, it needs chloride, it needs sodium. We need minerals to actually make stomach acid, and without adequate minerals, it's a vicious cycle. We also need minerals to make hormones. And so, really, the root of a lot of things is nourishment. Our clients need nourishment through a variety of foods, through eating enough, getting really mineral rich foods, etc. So, hopefully, at this point, you're understanding this is why probiotics alone won't fix the symptoms. And I hope that this gives you hope that there's a lot of things that you can do. This is why also Miralax, motility medications, taking a fiber supplement, taking the bloat pill that their friend tried that really worked for them is probably not going to fix the problem, because there's a lot of steps and a lot of things that we need to address, and things that go together. So when somebody's under eating, we will see cortisol higher. We'll see nutrient deficiencies higher. We'll see more blood sugar instability, a decrease in sex hormones, vagus nerve activation, and thyroid hormone. And then the gut consequences are more intestinal permeability, or what your client has probably diagnosed themselves with as leaky gut, what you're seeing all over the internet. Dysbiosis, just inflammation in general in the gut. Lower stomach acid, immune function that's lower, pancreatic enzymes that are lower. And so when we can look at this a little bit more holistically, we can actually create a plan and kind of see how these things overlap. So although your client might be constipated and be bloated, or maybe they have diarrhea and they're also bloated, we can see that there's a lot of commonalities and things that we can address that will really move the needle for a lot of the symptoms that they're having. So here's kind of this tiered approach that we're looking at. Number one is physiological stabilization. We can't make a ton of progress if the body's not getting enough nourishment. All the dietitians in the room probably spend a lot of their time talking about this. The body has to feel safe to heal, and one of the ways that the body feels safe is when it's fed. And so we have to make sure the client is eating enough. We have to address any electrolyte imbalances, stop purging behaviors, etc. Then we can support digestive function, and sometimes these things go together. So we can focus on meal hygiene, we can work on managing stress, we can support motility very gently. Things like ginger, digestive bitters are really easy things to implement, digestive enzymes if needed and indicated. Then you can get to the fancy stuff. But a lot of times people jump really quickly to the fancy stuff like stool tests or a SIBO protocol or whatever it might be. But it's not going to work if the first two steps aren't addressed. So we want to make sure that we're keeping ourselves grounded and not getting too excited about things, and supporting digestion, but not getting ahead of ourselves either. So here's just an example of how this can play out. So here's client A. They are struggling with bloating and constipation. This client is taking Miralax, fiber gummies, and a Align probiotic. Probably a case that you've seen before. She's exercising 2 hours a day. She's eating 1,500 calories, but severely limiting carbohydrates. She's getting 5 to 6 hours of sleep per night. What is missing with this client? She is dealing with reduced gut motility due to inadequate caloric intake. Her gut is a muscle. It can't contract without adequate nutrition. It also can't contract on lack of sleep without adequate mineral status. She's also dehydrated from fluid restriction. The gut needs water to help move things through. It also needs electrolytes to help move things through as well and help the cells actually absorb water. These electrolyte imbalances are also going to affect muscle contractions. I think many of us think of muscle cramps and then associate that with bananas, right? Why do we do that? Bananas are high in potassium. We need potassium to contract muscles. And I think the last study that I read said that over 97% of Americans aren't meeting their daily potassium needs. So it's more than likely that your client who's struggling with an eating disorder is not either. So getting more potassium in their diet can be really helpful. Obviously, there are scenarios in which potassium can be high in eating disorder clients, and that's not necessarily what I'm referring to right now. Lack of dietary fiber due to fear of bloating or avoiding carbs. A lot of our clients go on a low carb diet, even if it's subconscious, because they realize how carbs make them feel. They are super bloated after eating carbs. And why is that? It's because we need gut bacteria to help us digest fiber. And when we have a depleted microbiome, we cannot digest fiber because our gut bugs do that for us. And so it becomes this vicious cycle there. So the gut slows down in response to this prolonged stress and undereating. The chronic laxative use can lead to dependency and worsen motility. And then the fear of food intolerances can just lead to this avoidance of food, kind of further exacerbating symptoms. So here are some of the root causes that may have not been addressed for her and some places that I would start to help her feel better. Here's another example of how this plays out. So, this is client S, struggling with restrictive eating, occasional purging, acid reflux, and regurgitation. So, this client is experiencing low stomach acid due to chronic restriction, purging, and stress, a weakening of the lower esophageal sphincter from vomiting or prolonged stress. I've seen this quite a bit with some of our clients, delayed gastric emptying, and increasing pressure in the stomach. So, like I mentioned earlier, the stomach has to fill with acid in order to empty. And if it's not emptying completely, then we're going to have food sitting where it doesn't want to be for longer periods of time. This is then affecting the balance of bacteria in the gut and overall digestive function. So, chronic stress and anxiety can increase gastric sensitivity and reflux. When the body is in this fight or flight, we are not making adequate stomach acid. We are not making adequate pancreatic enzymes. And so, what do we need to do? We need to work on meal hygiene. We also may want to use something to help aid digestion in a case like this. Perhaps we use digestive bitters, or perhaps we use something like different enzymes to help the client break down their food and move it through. Purging behaviors can definitely damage the esophageal lining, making symptoms more persistent. We can use things like DGL. We can use things to help repair the tissue in the lining of the esophagus and then in the stomach as well. And then meal avoidance or delayed eating can definitely worsen acid reflux production and dysregulation. Okay. Next one is client L with a history of bulimia. She experiences sudden and urgent diarrhea. So, this client is experiencing different imbalances in her gut from restrictive eating, from purging, and then frequent antibiotic use. This is something that we see in our client's history quite a bit, especially if they were a 90s kid where everything got an antibiotic. And I'm not here to say no one should take antibiotics. That's not at all what I'm getting at. They can definitely be life saving. But there's a lot of kids who, throughout their life, just every time they got sick, took an antibiotic and were dealing with very shrinking microbiomes as a result. And so, maybe some of this was present before the restrictive eating actually started. She also is dealing with malabsorption of nutrients due to a damaged intestinal lining, increased stress and anxiety leading to a rapid gut transit time. We've all had that, right? A really stressful experience that leaves us running to the bathroom, that definite gut brain reaction. And then this client's also experiencing this rebound effect from laxative withdrawal and excessive sugar alcohol consumption. How many clients do you have that come to you eating all the Quest bars, all the diet products that have tons of sugar alcohols, and they wonder why they have such bad gas and they have a lot of diarrhea? That can be a really easy fix, maybe one that they might be resistant to, but sometimes it actually is something like that that is exacerbating the symptoms. So, we know, and we've talked about throughout this presentation, how chronic anxiety is going to activate the sympathetic nervous system, which is going to increase gut motility in acute states. Chronically, over time, typically it's actually going to stop and slow down gut motility. This fear of food reactions is going to cause heightened digestive sensitivity, which can increase diarrhea episodes. And then clients who have reintroduced food after prolonged restriction may kind of have this temporary malabsorption related diarrhea, especially when we're dealing with things like gluten or dairy. The body has to get used to digesting these things again. And oftentimes people think that, oh, I just can't tolerate these foods, when really it's just a process on teaching the body that it's safe and that it can digest these things, and aiding that process. So here's kind of how this can play out for this next client, client J. So, history of restrictive eating, experiencing severe bloating after meals. So, this is a little different than someone who might have just chronic bloating. Maybe your client actually wakes up and they feel pretty good, and then they bloat the second that they eat or the second that they drink water. This often has to do more with how someone is actually digesting their food and then the balance of bacteria in their gut. Sometimes coupled with motility issues, really chronic motility issues, you'll see someone waking up bloated most of the time, or like, going days without a bowel movement. In this case, this client Jay may be experiencing some motility issues, but since it's happening pretty severely after meals, I'm more likely to believe that it's possibly more of like a meal hygiene, how she's breaking down her food. So, reduced stomach acid and digestive enzyme production, leading to just this fermentation of undigested food in her gut, kind of exacerbating this process. So, when she reintroduces carbohydrates after restriction, this can actually cause temporary water retention. It can cause fermentation. And so, if you're able to assist digestion in the process via maybe some enzymes, via maybe some digestive bitters, slowing down at meals, chewing food, being really strategic about spacing meals out, etc., we can ease maybe some of these symptoms. So, clients with eating disorders often experience hyperawareness of body sensations, which can make bloating feel even more distressing. And that's definitely something where, if you are a dietitian, having a therapist on your team and having a full treatment team is really essential, so that the client has the support that they need, especially as they work on eating more, supporting their digestion, and kind of working through some of that distress that comes up. Food avoidance due to bloating will actually then just worsen gut motility, and the cycle, as you know, just repeats. And then the vagus nerve dysfunction from chronic stress can contribute to sluggish digestion. So you can see that there's a lot of pieces going on. But what I really want to drive home today and help you understand is that the body has to feel safe to heal. So this means adequate nourishment, this means hydration, this means adequate sleep, and even adequate rest. Rest can also be just relaxation. It doesn't always have to be sleep. Are they having any downtime? Are they doing anything that's fun and enjoyable to them? When the body doesn't feel safe, it will slow motility. It will decrease salivation. It will decrease stomach acid production. It will decrease pancreatic output. And then it can impact digestion and the amino acids and nutrients needed for just overall body detoxification and digestion there. So, really, it starts this north to south process and starting with how are we approaching the meal? How are we relaxing before the meal? And then do we need to aid digestion and gut motility along the way? So here's just some example intervention steps. Working on normalizing intake will slowly increase calories, especially carbohydrates if they're having symptoms afterwards for improved motility. The thyroid itself, which helps to regulate gut motility, needs a minimum of like 150 grams. Obviously, that's going to vary person to person, but on average, 150 grams of carbohydrates per day to function optimally. We also want to work on meal timing and composition. So, providing these anchor meals or just gentle guidelines to balance blood sugar. Anytime blood sugar is too high or too low, that can be a stress on the body as well. So, how are we stabilizing blood sugar? We want to reduce stress, mindful breathing, progressive muscle relaxation, whatever it is. Then we can bring in supplements and lab testing that might help to aid some of these things. So, GI symptom relief, I believe, directly improves psychological comfort and food tolerance, which will increase treatment success rates. A root cause approach, so really understanding how is this all connected? Is there a motility issue that's causing the constipation? Is there a digestion issue that's causing some of this bloating after eating? Is there a microbiome imbalance? Is there all of the above, which is really common? This can lead to better outcomes and long term recovery outcomes. And then practitioners across disciplines, so therapists, dietitians, medical providers, we all have to work together. We all need each other for various reasons. And so we all need to be on the same page to just ensure that GI distress is not a barrier to full recovery and that our client has the tools that they need to succeed. So here's the roadmap. I already talked about this, but here's just a more visual roadmap. We don't want to rely on quick fixes. That often fails to address the bigger picture here, the nervous system dysregulation, the poor digestion, the poor gut motility, etc. And then we have to be collaborating in an ongoing fashion with the treatment team. So here is a little, my whole slide is not loading, but that should say thank you. Oh, there we go. um, Here's where you can find me. My website, my Instagram, or my podcast. I would love to hear from you if you have questions. I am an open book and always love chatting. So I love to chat with you after. And I also have a digestive checklist that you can download as well if you want to scan this QR code that has just some practical tips on supporting digestion and different things that you can do with your clients if that would be helpful to you.
Thank you, Heather. Um, I'm speechless for a number of reasons. Number one, that was awesome and so much great information. Thank you so much. And second, I need to try and apologize to our attendees. We have almost 1,000 of you on, which I'm so appreciative and grateful for. And I'm trying to respond to your questions as fast as my little fingers would fly. And there are lots of you that did not get a response saying, hey, we'll try to get to this at the end of the presentation. So if you didn't hear from me, know that I saw you and I was trying, and we'll pull up those questions here in a minute and go through some of those. Before we do that though, Heather, will you go back to the previous slide before the QR code?
Sure.
If anybody wants to take a picture of this, a screenshot of this, or take a picture of this so you know where to find Heather. And just FYI, she has about 60,000 followers on Instagram, so she's a big deal. We're really grateful to to have Heather with us here. And so that if you want to take a picture of that slide, now's your chance. And then Heather, if you'll do the same on the next one,
Oh, okay.
they can scan your QR code if they'd like to. Because after that, I'm going to have you stop screen share and I'm going to screen share mine with the QR code to take the test. So
Perfect.
folks, if you want to scan this QR code or take a picture of this as well, now's your chance.
And if you need this, you're always welcome to reach out to me. I am happy to send you the link to download this checklist. If you're like running to a client session or something, I'm not stressed about it. So yeah.
Perfect. Thank you. All right. Will you stop screen share and I will share mine. Well, we'll just do a couple of quick housekeeping items. There we go. So that folks, as Heather mentioned, we know lots of you are clinicians and maybe have somebody that you need to meeting or a appointment with someone you need at the top of the hour. So we want to make sure that you have all the information you need before you go in case you have to hop off early and can't stay on for Q&A. So here's your reminders. When the webinar ends, please fill out the webinar evaluation that pops up on your screen. It will be the same screen that you're looking at now. When I close the webinar or you leave the webinar, in this same screen, you will have a pop-up with the webinar evaluation. That's a continuing education requirement for us. We tabulate those results, send them to the CE provider entities. It's completely anonymous, so please feel free to be candid in your feedback. Also, when the webinar ends, when I end it, or if you leave, have to leave before we're finished, there will be a new browser tab that will pop up with a link to take the online test. You must take the test online in order to receive continuing education credit. Once you pass the test on the test site, your continuing education certificate will be available for download on that screen. So look around for it while you're in the test site. If you don't have time or you need to get on with your life today and you want to do it later, you'll receive a follow-up email from Zoom tomorrow with the link to take the online test also. So don't stress about it. And lastly, there's a QR code here on this screen if you want to get your phone out and get your camera going and do that QR code. That also takes you to the test. Okay. Ready, set, go. I'm going to stop the share so I can see Q&A. Okay, as you can imagine, we have a ton. And
I was just browsing some of them.
Oh, good. I'll let you start then. Do you want to start? Do you want to, or do you want me to pick some?
Go ahead and pick some.
All right, I'll pick some. As I was saying, we won't get to all of them. We just have so many. So feel free to reach out to Dr. Finley on our Instagram page or any of the things that the other avenues that she put up on the screen. So you can, if we don't get to your burning question today, and there's lots we won't get to, just know that you can still get those answered. All right, I'm going to get clear back to the beginning and try and get some of those. Okay, this question is from Marie. And Marie says, if you have a client who perseverates due to high anxiety, what information is helpful to share that is a non-dietitian? So I think, in other words, from maybe a therapeutic standpoint, a therapist standpoint, do you have some suggestions that you would make there?
If I'm understanding the question correctly, I think the best way maybe to just describe it is, your body cannot digest if it's in an anxious state. And so, although, like I said in the presentation, it's never going to be perfect. How many times have we all eaten right after a work call or while we're driving or something? But like, what can you do to ease anxiety a little bit in that moment, whether that's taking a deep breath, whether that's, just like calming your system a little bit. And then even after, especially if somebody's having symptoms after a meal, like you don't just have to take a deep breath before eating, you can do it after too.
Thank you.
Or hum happy birthday. I saw there was a question actually about that.
Yeah, I saw that one too, Heather. They were just saying, does the humming actually do something, or does it just make you take time to be mindful? And I know the answer, but I want you to tell the answer.
So it's both, which is why I love it. So it probably would make you laugh a little bit. Actually, we have a client who told us the other day that now when she's sitting in traffic and wants to have road rage, she just starts humming instead. And her husband is like, "What are you doing?" So there's your free tip of the day for your road rage. But yeah, it actually does stimulate the vagus nerve. And the vagus nerve is going to help get the body into that rest and digest state and out of kind of that fight or flight and help with that the stomach acid production and pancreatic enzymes and all of that. So it really does kind of serve two purposes. And there's lots of ways that you can stimulate the vagus nerve. You can do it humming, singing, um, cold showers. There's fancy devices that you can get, but I mean, you can easily do
I
it just
mean,
by
really,
humming.
right?
Yeah.
Okay, next question. This is from an anonymous attendee. I really liked this question because I think many of us have been in this situation. This person says, how would you advise a client to advocate for themselves when seeing a GI doctor? I've had personal experience with a GI doctor brushing off the nutrition aspect and wanting to give medication or cutting out a certain food right away without any other testing. I think we've all been in that situation where we feel like I need to say something, I'm not sure what to do.
Yeah, it's so tough. I mean, I think we're getting to the point where nutrition is being recognized as helpful for GI issues slowly. But what we always tell our clients is go in with a list of questions and do not let the doctor leave until your list of questions has been answered. And, sometimes that's successful and sometimes that's not. But I think you can also approach it from the aspect of like, hey, I am bloated regardless of what I eat. I'm constipated regardless of what I eat. I've tried the food elimination and I haven't gotten anywhere. I want to look at this like a little bit more holistically. And for me, especially with my history of an eating disorder, I'm not going to just start weed whacking foods out of my diet, especially because it's probably going to be another 6 months until I see you. So I'm not going to do that without proper follow up and proper, communication with you. So, like, what else can we look at here instead of like, okay, take Linzess, great, but also can we look at the full picture? They'll probably then recommend a colonoscopy or something. And I think colonoscopies can be great. I think that they can be very preventative and helpful. And so I would always tell people to, err on the side of caution if you think that there's an issue. But there's a lot more pieces to the puzzle. And so, sadly, if you're not getting the answers that you want from your doctor, it just may be time to go to somebody who is going to give you answers if you've ruled out all the big things. I think a lot of times doctors are ruling out disease, which is good, right? You want to rule out the fact that you have inflammatory bowel disease or you have colitis or you have whatever. But if you're kind of in that bucket of like, I don't have any of those things and we've ruled all that out and you're not getting anywhere, then there still can be some functional stuff going on that they just might not be the right person to help you with that specifically.
Thank you. Okay, Aubrey asks, when constipation is caused by a side effect of a medication instead of eating disorder behaviors, is there a different approach you would take or would it be similar?
It would be similar. We have clients like this all the time. For whatever reason, they're on certain medications that will slow down the bowels. A lot of the interventions, so like ginger, for example, is really helpful for gut motility. We typically recommend like either ginger tea, ginger capsules, and there's other motility supplements depending on what medication somebody's on that they could try. I always start with ginger because it's cheap, it's easy to get, and it's usually pretty effective for most people. And so, yeah, you would approach it the same. You probably are going to need some combination of like ginger and minerals, whether that's magnesium, whether that's potassium, or some combination, sometimes sodium as well. So, yeah, you do approach it the same. Although, if a medication is causing it, sometimes you need stronger support. Not always, but we have seen that.
Thank you. I'm trying to find there were several questions about bitters. And
Hmm.
specifically, what are they? How do I
Yeah.
get them? Can you just make
Yeah.
just a little bit more on that?
Yep. A PSA about bitters. So bitters are amazing for digestion. Bitters are found in foods. So bitters are found in things like dark chocolate, in arugula, in radishes, any kind of bitter food. If you've ever, you probably haven't, but if you've ever just like eaten a handful of arugula, you've probably noticed that you've salivated a little bit. So what bitter herbs do is usually they make them in a little tincture, and you can get them like Urban Moonshine is a really popular brand. They have an alcohol-free tincture and they have just a regular one. And you would take a dropper full before meals. And the goal is that they stimulate salivation and then it starts that whole digestive process. So the salivation then signals to your stomach acid, hey, food is coming. And so it can help aid digestion. We also love bitters for symptom relief. So your client that's like, got kind of the bubbly stomach after eating or the hard distended bloating, you can use bitters in between meals to relieve symptoms while you're working on getting everything working again. You can use them up to, I think, 6 times a day. So they're great and they're bitter. So you just be aware. The name speaks for itself, but that's the point.
Right.
So,
Thank you. Okay, let's do one more. I want to end on this one because I think it's a great question and I want to leave on a hopeful message. And you do such a great job, I think, of describing how hope is part of the whole process, right? That's the idea, that we get to feeling better and that our clients get to feeling better. So this is from Monica. Monica says, can GI symptoms or issues still occur when someone is in the recovery phase?
I actually see this a lot. Most of the clients that we get are what they would consider recovered. They're like, I don't restrict anymore. I don't purge anymore. I live a healthy life. And why am I so bloated? You see this backlash of GI symptoms that can happen years later due to probably a lot of things. Is it just the eating disorder? No. What we like to do is look at someone's timeline, like birth till now, what were kind of the domino effects. And the eating disorder, of course, is a big domino, but there's probably other things on there. Maybe a stressful life event. Maybe they had a time where they were taking a ton of antibiotics, or childbirth. That's a big trigger for a lot of the moms that we work with. And so, yeah, it can happen years later, and it's sometimes triggered by something else, like childbirth, or like a car accident, or like just a period of time where they just weren't sleeping as much, or whatever it might be. So, yes, I would say that happens more often than you probably think it does. Where you think, oh, I'm in the clear, and then years later, yeah.
Which is why folks like you exist, right? And are wanting to help people feel better, that there's hope. There's hope in recovery. There's a path to recovery. And when you're in the recovery phase, there's still things that maybe need to be addressed, but they can be addressed. So
Yeah.
thank you, Heather. I so appreciate it. It was great to have you here. As always, we love having Heather with us, and we're so appreciative of all of you who attended today. If you have a burning question for Heather, as I said, you can track her down. You can also email me at info at, nope, that's wrong, CFC webinars. There we go, cfcwebinars@gmail.com. And take good care, and we hope to see you again next time. Bye, everybody.
Thanks, Tamara.